Hello, all set? Okay. I'm first going to start by inspecting your abdomen. I'm going to pull your gown up. I'll be looking at the color, looking at the contour of her abdomen. I look behind her head for symmetry. Look for any pulsations, masses. Look at her ease of breathing. Okay, now I'm going to take a listen. And as I'm listening to each of the 4 quadrants, I'm listening for regular vowel sounds or that are irregular. Should happen about 5 to 30 times per minute. Be listening over her liver and her spleen, listening for friction rubs. With the bell, I can listen to the epigastric area and the umbilicus area, listening for any venous hums. Listen to the aorta. Listen to the renal arteries. Listen to the iliac arteries. Listen to the femoral arteries. While I'm doing this, I'm listening for bruits. Okay, now I'm going to be tapping on your abdomen. As I'm doing this, I'm looking for dullness over solid organs. Listening for tympany over the fluid-filled or hollow organs. Okay, now I'm going to find your liver borders to see that your liver is the correct size. So I first start by pressing up. So I hear dullness. You mark that spot. Then I'm going to percuss down to an area of resonance. Until I feel dullness. And mark that spot. Then I'm going to measure that distance. It should only be about 6 to 12 centimeters. Okay. Now I'm going to be feeling your abdomen. Let me know if you feel any tenderness at all. I'm feeling for any muscle resistance, any bulges, masses, lesions, any muscle spasms. Noticing her facial expressions, looking for any guarding. Okay. Now I'm going to have you sit up. I'm going to test for tenderness in your kidneys. I do this by doing the fist percussion on each side. Tell me if you feel any tenderness. Okay. Now I'm going to be lowering your gown so I can inspect your chest and listen to your lungs. So I'd be looking at her thorax, looking for any obvious deformities, looking for symmetry, shape, looking at her costal angles. And also look at the back, noting any lesions. Okay, now raise your arms. Look at each side. The anterior posterior diameter should be about half of her transverse diameter. Okay, you can lower your arms. While I was doing this, I would be assessing the respiratory rate, noticing her rhythm, ease of breathing. She should be breathing about 12 to 20 times per minute. We'll look at your nail bed, looking at the color, make sure there's no cyanosis. And can you put your fingers together like this for me? straighten them out just a little bit. There you go. Looking for clubbing. Now I'm going to be feeling your heartbeat. I'm placing my hand on your chest. You're feeling at the apical impulse, which is the fifth intercostal space, mid-clavicular line on the left. Looking for heaves or lifts. Feeling the left sternal border for any displacement or widening impulse. Also feeling with my fingertips. And again at the apical impulse. Okay. I'm going to be feeling your carotid at the same time, looking that the pulses are synchronized. Okay. Now I'm going to be feeling on your chest. I'm going to start with the back. Let me know if you feel any tenderness. Looking for symmetry of the muscles, any bulges, lesions, depressions. Feeling for any crepitus. Feel for thoracic expansion. Okay, take a deep breath and release. Okay, looking for symmetry with that. Okay, I'm going to have you say 99.
99.
Okay. And again.
99.
One more time.
99.
Okay. Feeling for tactile symmetry. Now I'm going to be doing the same thing on the front. Okay. And again, checking for thoracic expansion. Take a deep breath and exhale. Okay, good. Now can you raise your arms for me? Feeling the sides as well. Okay. Now I want you to fold your arms and bend your head again. I'm going to be tapping on your back. While I'm percussing, I'm listening for sounds of resonance over the lung areas. Okay. Then do the front. Okay, and now raise your arms for me. Do the same thing to the side. Okay. And while I'm doing that, I can be assessing her respiratory rate, as well as the rhythm, listening to how she's breathing. Now I'm going to take a listen to your lungs. Start with the back again. I want you to just take slow, deep breaths for me. Okay. So we'll be listening for normal breath sounds, bronchial, bronchiovesicular, vesicular. Listening for any cracks, crackles, wheezes, stridor, pleural friction rubs. Okay, now I want you to say 99 again for me.
99.
Again.
99.
Again.
99.
One more time.
99.
Okay, there I'm listening for a muffled sound. Okay, now I'm going to listen to the front again. Or listen to the front. Take a deep breath. Okay. Yeah. Okay, now raise your arms again for me. Listen to the side. thank you. Now we'll be listening to your heart. I'm going to start with the aortic area, which is the second intercostal space at the right sternal border, and the pulmonic area, second intercostal space in the left sternal border, the second pulmonic area, third intercostal space at the left sternal border, tricuspid area, which is the fourth intercostal space at the left sternal border, and then listening at the apical site, the fifth intercostal space midclavicular line. I'd listen to this area for a full minute. I'd be listening for any abnormal sounds, S3 or S4, snaps, clicks, rubs, splitting if there's any kind of murmur, and noting if it's systolic or diastolic. I'm going to go over these areas again with the bell of the stethoscope. Again, listening for the same things. Okay. Now I'm going to be feeling several of your pulses. I'm going to start with the carotid. While I'm doing this, I'm noting the rate, the heart rate, and its rhythm. Noticing symmetry and strength of each side. Okay, now I'm going to look at your brachial. Okay, and the other side. Okay, and your radial. And the other side. Okay. Now I'm going to have you lay down. I'm going to feel for your femoral artery. This one's a little bit stronger, probably about a 3. Okay. Now I'm going to have you turn over so I can feel behind your leg. Okay. So when feeling your popliteal artery, I'm going to have you bend your leg slightly. Okay, another one. Okay. Right, now I'm going to have you sit back up. We can put your gown back on. Now I'm going to be feeling for the arteries in your feet. So give me one foot. Okay. And so I'm going to be feeling for the posterior tibial artery, the dorsalis pedis on each side. Okay, other foot. Alright, thank you. Okay. So now I want to test your balance and coordination. I'm going to ask you to take your thumb and touch it to each one of your fingers, back and forth. And can you do it a little bit faster? Okay. Thank you. I'm looking for ease of movement, no overshooting or tremor in our hands. Now I'm going to have you stand, your hands at your side. And close your eyes. I'm looking for any excessive swaying. Okay, good, thank you. You can sit back down. And now to finish off our head-to-toe assessment, I'm going to be asking you a few questions to assess how you're thinking. I'm going to give you a simple analogy, and I want you to answer it to the best of your ability. So a kitten is to a cat like a puppy is to a
Dog.
Okay, great. Now, can you explain the difference between an apartment and a house for me?
A house is one building. An apartment is a building with multiple rooms.
Okay.
Or
Okay, so several different houses and
one building.
okay, gotcha. And while she's talking, I would be assessing her speech, looking at the fluency and articulation, the ease of talking while she's breathing. Okay, well, that completes our head to toe assessment. I will be checking in with the doctor, and he'll be coming to see you soon, and hopefully he'll be making you feel better.